Make sure before you do any type of physical touch that you ask their permission first. As a midwife, to call me when your contractions are 411, meaning those contractions are 4 minutes apart, lasting for a minute, lasting for 1 hour. That's 411. That's when I want you to call me and be like, hey. Now sometimes our doulas will call and say, hey, you know, she's been 411 for so long, blah, 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 blah. I'm going to want to talk to that mama, because if she can talk to me and hold a whole conversation and I don't hear not one contraction, she most likely ain't ready to. Belly lifts, because sometimes we'll have you do belly lifts. And sometimes we usually just have a dad stand up against the wall, or whoever partner standing against the wall, and mama stand in front of them and they just hold the stomach up. Or you can just get in front of them and you just put your rebozo in the front and just pull up, and it just gives her a brief reprieve, because that baby get down there. So this is kind of pulling baby up and getting baby up out the way. Do the squat when they are in having a contraction. So you have your contraction and I have them go down into a deep squat. Hold on to this. Sometimes if they need to do a lunge.
So a lot of people, when they're going through that process, you often forget, especially once you've already given birth. You know, your oxytocin's high, you're just wanting to love on baby. You forget what I need to do for myself after I've given birth. You know, I would lay on the ground on a matted surface, of course, not like hard floor. You don't want her on a cold floor. And that's the other thing. No, first 40 days, she should always have socks on her feet. And that's something I try to educate them on, because also, again, coldness in the womb will delay healing. And so the feet, of course, like especially now in this type of weather, you can feel like when you're home, that's the first thing that you usually feel when you're cold and you want to wear socks. So it's the same approach. You want to make sure that their feet it has socks or something to keep them warm. And then they would lay on the surface, a matted surface, and you would have them wrapped again, but from the chest